Hello, this is Dr. Prashant. I did MD Psychiatry, and we have started a rehabilitation center 4 years back. We have two branches. One branch is in Karjat, which is 70 bedded, and second in Pune, which is 100 bedded. So over these 4 years, I have realized that whenever the patient decides to get admitted in the rehabilitation center, or their caregiver wants to admit him in the rehabilitation center, they have a lot of questions in their mind. They have anxieties, apprehensions about the culture of rehabilitation center. So first fear is regarding the stigma. So we all know that mental illness is carrying a lot of stigma in Indian society. So the patients with mental illness are discriminated against, and there are a lot of myths regarding mental illness. So when your patient decides to get admitted in the rehabilitation center, first and foremost point comes in his mind that what about the society, what they will think about me. So he is admitted in the rehabilitation center. Second fear in his mind is, am I going to lose my independence? Will they confine me forever in the rehabilitation center? And third fear is, will this rehab will really work for me? Because there are a lot of myths regarding rehabilitation center. So in this video, I'm going to think about these fears. I'm going to tell about these fears and what are our real experiences in our rehabilitation center when we are running this. So first, regarding first fear, stigma of the mental illness when getting admitted in the rehabilitation center. So yeah, so whenever a patient decides that he's going to get admitted in a rehabilitation center, the relatives, the friends, the people in the society, they do tell them, the patient and the caregiver, that why you are going to admit the patient, because they think that getting admitted in the psychiatric rehab carries a lot of stigma, and the people will label him as he's having psychiatric illness. But the reality is, if you don't take the proper treatment for any psychiatric illness, and if you don't recover, the stigma is going to be there forever in your life. And if you take the treatment in rehabilitation center, you take, because in our rehabilitation the treatments are customized to the needs of the patients. If the patient is having substance use disorder, there are different treatments. If the patient is having psychiatric illness, there are different treatments. So for example, I will outline the treatment of substance use disorder, whether it is alcohol, cannabis, or any substance. So the treatment is divided into three parts. First is detoxification, second is maintenance phase, and third is relapse prevention. So in detoxification, we treat the physical or psychological withdrawal symptoms with the medicines, and once the patient is stabilized, the patient moves into maintenance stage. So for detoxification, it usually requires 5 to 7 days of time. And then when patient moves into maintenance stage, there is one-to-one counseling, group counseling, motivational enhancement therapy, where we give the therapy, different therapies like motivational enhancement therapy, cognitive behavior therapy, rational emotive behavior therapy, to enhance the motivation of the patient to quit alcohol or any other substance. And when the motivation is at optimum level, so the patient moves into another phase, that is relapse prevention. So in relapse prevention, we teach the strategies to the patient regarding prevention of relapse, because when the patient is in the rehab, he is in a protected environment. So whenever he goes into the real naturalistic environment, there are a lot of external cues, like if he sees the wine shop, or if his friend insists him to take alcohol. So how to avoid those temptations, how to prevent him from the relapse. So it is covered in the relapse prevention strategy. So another major indication for rehabilitation center is severe psychiatric illnesses like schizophrenia. So in schizophrenia, so if you fear of the stigma in the society, if the caregiver is fearing, that patient is going to deteriorate, okay, over the time. There is one concept called DUP, duration of untreated psychosis. So if the patient is not treated for longer duration, the prognosis or the outcome of that illness over the time is worse. So treatment should be get patient should get the treatment in time. So the stigma, so the first fear in the mind of patient or the caregivers, the stigma. So if you think about the stigma in the society, if you fear of the stigma, you are actually going to reinforce that stigma, because that patient is going to deteriorate. He will not be able to function in the society. He will not be able to carry the activities of daily living in the society. So I will outline the treatment of schizophrenia in our rehabilitation center. So if the patient is having positive symptoms, we call it as aggressive symptoms, or positive symptoms, patient is violent or getting aggressive towards his relatives, or he's trying to harm himself, he is having delusions, hallucinations, we call it as positive symptoms. So we treat them with the injectables or tablets or any other medicines, long acting injectables, and we stabilize the patient in the acute phase, and then patient is moved into the another phase, that is maintenance stage. In maintenance stage, we give him therapies, because now many therapies are coming for the chronic patients with psychosis. So there is one therapy, CTR, recovery oriented cognitive therapy. It is an adaptation of cognitive behavior therapy. So we usually follow that therapy, CTR, that is recovery oriented cognitive therapy, in our rehabilitation center, to address the challenges in the challenging behavior in the patient, like if he's having negative symptoms, positive symptoms, or he's having challenge in the communication. So our therapists in the rehabilitation center, they do one-to-one counseling, then group therapy, we have art therapy, music therapy. We try to like enhance the maximum potentials in the patients, and we occupy them around the clock in the activities in the rehabilitation. It's just not like that the patient is dumped in the rehab, because this stigma regarding rehab is also enhanced because of a lot of non-medical professionals, they are not trained in the psychiatry, or they are not trained in the field of clinical psychology. They are, in the name of NGO, they are themselves opening the rehabilitation centers. Such rehabilitation centers are mushroomed throughout the country, and they don't give the scientific treatment. So there is stigma regarding the rehabilitation regarding rehab center in the minds of patients and caregivers, that the patients are just dumb there, they give the medicines and make them sleep. Okay, so in our rehabilitation, because it is a scientific rehabilitation center, we have multidisciplinary team consisting of psychiatrists, clinical psychologists, rehabilitation psychologists, staff nurses, attendants, art therapists, music therapists. So this is multidisciplinary team, and we give the evidence-based treatment. So so the rehabs which follow the unethical practices, or which are not evidence-based practices, our rehab is completely different. So I address the first fear, that stigma. So I will tell in one line that if you fear of the stigma, anybody like a patient or the caregiver, you are actually reinforcing the stigma, because you are not allowing the patient to recover. And if the patient is recovered and he goes into the society, he is present in the society, and when the society sees that the patient is recovered from the psychiatric illness, actually that stigma will go down. So if you want to reduce the stigma for the mental illness and for yourself also, you should get the proper treatment, adequate treatment, and rehabilitation center is one part of the treatment along with outpatient treatment. Okay, so the second fear is the patient thinks that whether I'm going to lose the independence, whether they are confining me for the longer duration. A lot of patients, relatives, at the time of admission, they have anxiety or apprehension that whether the patient will hold the grudges against them, because we are admitting him in the patient. If he comes back from the rehab center, will he get hostile against me? So all these concerns we have come across throughout last 4 years. So regarding the fear of losing independence, yeah, actually independence is the most precious thing. And now new legislations like Mental Health Care Act 2017 has come up. They have put forth the guidelines regarding the admission, duration of admission also. And in our rehabilitation, I want to stress on the point that we thoroughly follow the guidelines regarding Mental Health Care Act 2017. the duration, the stay. We don't necessarily extend the stay, and we don't necessarily we don't admit the patient unnecessarily without any proper indication. So patients or their caregivers should be very what you call they should not have the anxiety regarding losing the independence of the patient, because in fact in rehabilitation center, when the patient is having proper treatment, when he goes into society, he is reintegrated in the society and he regains his independence. Okay, and he can work, he can have some meaningful life, he can gain whatever the potential he has lost due to the mental illness. And the last fear, third fear, which I told at the start of the video, the patients and most of their caregivers, will this rehab really work for me? Or if like many patients or the relatives have the apprehension that is it a money making business, and only they are dumping the patients for years together or months together. So I want to tell you, there are a lot of studies, a lot of research articles have come up regarding the utility of rehabilitation centers, regarding the significance of rehabilitation center in the recovery of the patients having severe mental illness or substance use disorders, severe substance use disorder like stimulants or opioids, alcohol, cannabis are all common psychiatric substance use disorders. So there are a lot of research articles. The research is coming in, which says that rehabilitation center does work. Okay, so through this video I want to ensure the patients and their caregivers that you don't bear these fears in your mind, and you just select a proper rehabilitation center which have the proper facility, which is driven by medico like psychiatrists, physicians, clinical psychologists, because this is very important for your recovery and your reintegration in your society. Thank you. See you in next video.